Hello everyone, myself Muskan Maheshwari, an intern from Vedic Dental College. Today we'll be discussing about attachments in fixed appliances. Starting with lingual buttons are passive components of fixed orthodontic appliance. Uses these are the accessory attachments other than brackets and tubes which are placed on the lingual aspect of the teeth. These are buttons with variable shaped bases for attachment of elastics and elastomerics. Here are the types. On basis of design, flat base for centering on molars, curved for mesial or distal placement on molars, extra curved for use on premolars. On basis of attachment, it can be weldable that are welded on the palatal aspect of band and are usually without mesh, bondable that are directly bonded on the tooth surface and have a mesh. We shall proceed with a video for better understanding of bonding of lingual button. Here is a video showing the use of lingual button for the attachment of elastics. Here is an example of lingual button which is used to move tooth both buccally and lingually at the same time. Next is lingual sheath. Lingual sheaths are passive components of fixed orthodontic appliance. Uses lingual sheaths on molar bands are used to hold wires from removable NANS appliances, transpalatal arches, molar rotators, expanders, lower lingual arches, and other appliances. Design: each sheath usually has an indentation on the distal end that serves as a catch to prevent the arch wire from slipping out. Here are the types. On basis of attachment, bondable that are directly bonded to the tooth surface, weldable that are welded on the palatal aspect of the band. On the basis of design, lingual sheath with the ball hook and lingual sheath without hook. This video shows lingual sheath that is welded to the band. This video shows the use of lingual sheath to hold the arch wire of the transpalatal arch appliance. Here we can see the action of the transpalatal arch. Moving on to the molar tubes. Molar tubes are also known as the buccal tubes and are the passive components of fixed orthodontic appliance. Uses: they are generally used on molars as an attachment and help provide better three-dimensional control of these anchor teeth. Design: molar tubes are horizontal hollow tubes which can be round, rectangular, or oval in shape. Let's see the classification. Classification based on mode of attachment is weldable and bondable. Classification according to the lumen shape is round, oval, or rectangular. Classified according to the number of tubes. Single tube is used to anchor main arch wire. Double tube used for auxiliary wires or the headgears. Triple tube consists of three tubes in which two are rectangular and one is round, which is used for headgears or lip bumper. Classified according to the technique. Now Beck tube is round or oval. Edgewise tube can be rectangular with 0 degree tip and torque values. Pre-adjusted edgewise is rectangular with prescribed in-out tip and torque values. Here we see different types of buccal tubes along with their parts and its placement. In this video, we can see placement of molar tube welded to the molar band. We'll now discuss about the crimpable hooks. Crimpable hooks are passive components of fixed orthodontic appliances. It is used for en masse tooth retraction when force needs to be passed from or near to the center of resistance. Now the design, it consists of a hook body and a base tube. The hook body aids in engaging elastics or closed coil springs for retraction of anterior segments. They are fixed on arch wires and crimped using crimpable hook pliers. Here are the types. Crimpable hook. The hook body of orthodontic crimpable hook has a ball shape. These are more flexible and can be curved to the right or left side. It can be long, medium, or short. Power hook. The hook body of power hook is a hook with the shape of question mark. This type increases acceptable tractile elastics. They allow quick and simple placement of the hooks in the desired position with the arch wire in or out of the mouth. It can be placed mesial to the cuspid anywhere on the arch without having to remove or replace the arch wire. This video shows placement and different purposes of crimpable hook. Coming on to the elastomeric chain. These are also known as E-chains or elastic chains, are active component of fixed orthodontic appliance. Uses, these are mainly used for space closure. Design, these are elastics that are available as long chains of interconnected rings and are made up of synthetic material. Types. These are available in three different strengths based on the distance between the rings: continuous, closed or short, and long. Let's look into the placement of each chain. Let's get to know about the intraoral elastics. Intraoral elastics are active component of fixed orthodontic appliance. Uses, They are used for closure of space to correct open bites, treatment of crossbite, and to correct interarch relationships. Design: these are elastics that resemble rubber band. They can be of latex or non latex material. Types: elastics are available in various strengths, which is dependent upon their diameter and thickness, and are also color coded according to strength for ease of identification. Applications: Class 1 elastics. These are intra-arch elastics placed mainly between the molars and the anteriors in the same arch. Here is a clip for the same, where class 1 elastics, class 2 elastics, and coil is used for this closure of extraction space by retracting the anteriors and protracting the posteriors. Class 2 elastics. These are intermaxillary elastics placed between the mandibular molars and the maxillary anteriors. As you can see, the elastic is attached from the mandibular molar to the maxillary canine for the retraction of the maxillary anteriors. Class 3 elastics. These are intermaxillary elastics that are used for the treatment of Angel's class 3 malocclusion. The elastics are worn from the maxillary molar to the mandibular anteriors to bring about retraction of the mandibular anteriors and protraction of the maxillary molars. Diagonal elastics. These are worn generally for the correction of midline deviations. Here we can see the correction for the shifted midline in the mandibular teeth. The elastics are worn across anterior teeth diagonally. Crossbite elastics. These intermaxillary elastics are used to correct crossbites or scissor bites in the posteriors. Their placement depends upon the tooth in the crossbite, generally from the palatal surface of the maxillary molars or the premolars to the buccal of mandibular molars or premolars. Small dimension elastics are used for this purpose. The clip here shows correction of crossbite using crossbite elastics. These elastics are worn from the palatal surface of the maxillary molars with help of a lingual button to the buccal surface of mandibular molar. Box elastics. These elastics are used to correct anterior open bites. They extend between the maxillary and mandibular anteriors in a box like fashion, causing forced eruption of maxillary and or mandibular anteriors. As you can see, the box elastics are positioned from maxillary right and left laterals to the mandibular right and left laterals, hence causing the correction of open bite. Triangular elastics. These are worn in the form of triangle involving three teeth. These types of elastics are used for cuspal interdigitation and are used with fixed mechanotherapy in finishing phase of fixed orthodontic treatment. They are also known as settling elastics. To visualize in a better way, we can see the elastic is worn involving one tooth in maxillary arch, that is the canine, and two teeth in the mandibular arch, that is canine, and the premolar. Advantages: these are inexpensive, relatively hygienic, and easily applied. Rubber bands are also easier for the patients to remove and replace. The material is relatively compatible with the mucosa. The great elastic range of elastics allow the extreme stretching produced when a patient opens the mouth while wearing the rubber bands without destroying the appliance. Resilience of natural latex rubber makes it useful for the application of intraoral traction forces in the range up to 6 to 8 ounces. Disadvantages: elastics experience a rapid loss of force due to stress relaxation, resulting in gradual loss of effectiveness. When extended and exposed to an oral environment, they absorb water and saliva and cause permanent stain and suffer a breakdown of internal bonds that leads to permanent deformation. Thank you.